When people first get here, they're greeted by staff, of course, and they get a little bit of an orientation. If they have family with them, the family also gets some orientation at that time. And then we go through the entire intake process. It can vary depending on the person, what the needs are. We get an assessment, of course, to find out which level of care they're needing when they come in.
I do the intake process. The intake process involves me getting a history of where the patient is and what brought them to us. That's their mental, their physical, psychosocial status.
And each client has an individual treatment plan that's developed by their counselors. And the counselors work together in a team as well, along with our clinical director.
As soon as a person comes in for intake, we are working to understand their needs and understand exactly what it is they're wanting out of treatment. So in doing that, it helps us figure out how we can work with what their needs are and come together as a team to help meet those in the best possible way.
First round of treatment, what people expect when they come in varies very widely. Some think that, hey, there's a magic pill, I'll just take the magic pill and I'm fine, I'm fixed. Other people are very scared. A lot of people are scared coming in, not knowing what to expect, how the process is going to work, or what they're in for. And as the nursing staff and the MA staff, medical assistant staff, we assist them through the process to get a better understanding what they can expect when they come through.
I think a lot of people expect to come here and get clean and be fixed, whereas I think that what really happens is they come here and actually get treatment and change their lives.
What I see from day 1 to day 3 is a dramatic change, especially if they have that feeling that they're getting better.
Our curriculum is based on evidence-based practice using best practice guidelines. So we incorporate the whole person in treatment. We come from a holistic standpoint. Our courses are focused on treating different aspects of the individual. With the holistic perspective, we incorporate the spirituality piece, the psychological piece, as well as the biological piece. So our groups focus on different parts of that. They can look like the neurobiology of addiction, mindfulness in the 12 steps, family therapy, yoga, meditation, acupuncture. We have a lot of different groups.
New Dawn addresses the underlying issues of addiction by really trying to treat the client as a whole person with the family system included. We include the family at New Dawn by offering family group nights, family counseling sessions, and we are very adamant about connecting with family members while the client's in treatment via phone calls or possibly group or individual sessions.
Group starts out with an hour of just the family members meeting with the counselor, and they talk about what's going on, why the person's here, and what they're hoping to gain out of the group that day. And then afterwards, the clients come in and join the family members, and they process whatever it is that the family is needing to talk about. So the family do come in and support each other.
We do believe that the longer someone remains in treatment, the better chances that they will have to prolong sobriety. And not only is that New Dawn's personal policy, that is also evidence-based data across the United States. Continuing care at New Dawn is every level of care from detox down to IOP. And once clients are done with IOP, we highly urge them to do our aftercare program, which is 1 day a week.
Our treatment guarantee is that if an individual completes 90 days of treatment at residential program, within 6 months after that completion, if there is a relapse, they are welcome to come back to our residential program and complete a 30-day stay free of charge.